So what we're doing today is signing a very, very unusual, probably unique Memorandum of Understanding between the Gaming Commission and the Health and Human Services, or as I say, their designee, to jointly manage the policy decisions and the funding decisions that will be made out of the Public Health Trust Fund to deal with research and problem gambling principally. We also felt that there were some other participants that should be at the table as the Public Health Trust Fund monies are used and as the impacts of problem gaming are assessed. And we asked Ann Powers, the Assistant Secretary from the Executive Office of Public Safety, Beth Bresnahan, the Director of the Lottery, who has been tremendously collaborative with us since she took over at the lottery, and Rebecca Gewurz, who is the CEO of the Mass Public Health Association, to serve on this steering group with us. The commissioner and the secretary will have to agree on any expenditures, but it'll be with the advice of this other group of outside stakeholders. They will join Mark Vanderlinden, our Director of Research and Problem Gambling, and Steve Keel, who is the Director of Problem Gambling Services for the Department of Public Health. So that's the network. I don't know if you have anything else you wanted to add, Mr. Secretary.
Sure. First off, I want to thank the MassGaming Commission for the Twitter follow today. I appreciate it as I'm growing my Twitter sphere. But I absolutely want to thank the chairman and my commissioner, Cheryl Bartlett, for helping facilitate this really very unique, as Steve mentioned, partnership between the MassGaming Commission and ultimately the Department of Public Health. We believe here in the Commonwealth that we are incredibly fortunate to have a gaming commission who is dedicated to balancing kind of the economic benefits of gaming with resources like the Public Health Trust Fund to address some of the unintended consequences of problem gambling. We know that this is going to support research into prevention, intervention, treatment, and recovery. And I think just from my perspective in terms of the short demo we just saw, the Shiny tool, I already have any number of ideas about how that can be used as a really effective tool across the Commonwealth as we think about public health and public safety. We are very excited to be here today to sign this MOU. As Steve indicated, I think the partnership will ultimately benefit the individuals of the Commonwealth, and we have a tremendous opportunity to do well by doing good here. So thank you to the Gaming Commission, and happy to be here.
Thank you. I think it's safe to say, as you suggested, this would not have happened without Commissioner Bartlett, so we really appreciate your putting your shoulder to this wheel. If the other members of the steering group would come forward and just join us, then Secretary Polanowicz and I will sign the MOU. Great. Thank you so much. Thank you very much. This is something that will be a long time. This will be rolling out for a very long time to see the benefits of this. But this is a really exciting start. Yeah.